Today I'm going to discuss about urinary tract infection, where I'll define what it is up to the end. Urinary tract infection is an infection that affects the urinary system. Urinary system entails the urethra, bladder, ureters, and the kidney. So any infection that affects the urinary path, or this path, is termed as urinary tract infection. It's more common in females than in males. The reason as to why it is more common in females than in males is because we have a shorter urethra as compared to males. And then the distance between the urethra and the rectum, where the most common bacteria colonizes, is also shorter. And the most common bacteria that causes UTI is called E. coli, though we have other bacteria like the Klebsiella, the Proteus, and others. But the most common one in most UTIs, like in 90% of the UTIs, you'll find that the E. coli is the major bacteria that causes it. When this infection affects the urethra, we term it as urethritis. When it affects the bladder, we term it as cystitis. When it affects the kidney, we term it as pyelonephritis. Usually we ignore some of the symptoms that UTI presents with, and then that's why this infection ascends from all the way from the urethra up to the kidney. And then when it gets to the kidney, it might come with other complications that are not good to our health. Some of the risk factors for urinary tract infection is one, the personal hygiene. That is why we encourage a lot of personal hygiene in women, and even in men, and in children at the same time. Women who are in their perimenopausal state, or menopausal or postmenopausal, at that point, whatever we call there's a hormone called estrogen. So the level of estrogen level is low, and they are more predisposed to urinary tract infection. Anatomy, how someone is made, can as well expose someone to urinary tract infections, and then some of the contraceptives or birth control pills can as well predispose you to this urinary tract infection. And then we have people who go to the loo to urinate, and then you don't completely empty the bladder. That is also a predisposing factor to urinary tract infection. And too much use of antibiotics is also predisposing you to urinary tract infection. At the same time, you need to rehydrate yourself. So dehydration is another predisposing factor to urinary tract infection. There are so many that I won't mention all of them. So some of the symptoms that this condition presents with is one, some of these conditions, they cut across in males and females, children, adolescents, and adults. So the first symptom that a patient might present to you with is something like dysuria. For the dysuria, that means that you'll have some pain during maturation or during urination. Patient will tell you that, doctor, if I go to urinate, I feel some pain. So that's a symptom of urinary tract infection. Or you might be having some burning sensation while urinating. That urine should not be that acidic to burn you. So when you have burning sensation while urinating, then that is also a signal symptom. Others will present with urethral discharge. It might be foul smelling urethral discharge, or it might just be a fullness, like the odor is not there. And then you might also present with urine that is foul smelling. You have dysuria, you have pain while while urinating, and then this urine also have a bad smell. So that's also a symptom of urinary tract infection. You might have a pain, low abdominal pain. Others might present with lower backache. Others might present with flank pains. So all these presentations, it's not a must that an individual present with all those presentations at the same time. Some other people might present with only one symptom, others two, others three. Others might present with all of them at the same time. So those are few symptoms, but now the severity increases with which organ has been affected. Like if it is here in the urethra, it is still not severe. And then if we wait, because we usually get this or experience these symptoms and then we ignore them. Remember, the more you ignore, the more the bacteria ascends and then complicates. So in children, actually, when we have UTI in children, and then it is now complicated. That is, it has been ignored for long, and the bacteria has ascended up to the kidney. That child will present with symptoms of malaria, and we might miss it even out, because this child will be presenting with hotness of the body. This child will be presenting with vomiting. This child will be presenting with something like nausea, you feel like vomiting. This child might present with loss of appetite. This child might present with chills. Now, you see, if you look at these symptoms, usually you get them in malaria at the same time. So you may run the test for malaria and then it turns negative and you're like, what's really happening? So I usually encourage, when the moment a child is brought to the hospital with these symptoms for malaria, I just go ahead and conduct urinalysis on that child as well. How to make the diagnosis? We usually send for things like urinalysis. We analyze that urine to see where there is a problem, and then in most cases, if there is a parcel, it will just show. It might also show you that the leukocytes are raised. Leukocytes, those are white blood cells. They are raised to mean there is an infection that requires to be treated. Sometimes we do whatever we call culture sensitivity. Culture sensitivity, we do it to know the bacteria. Remember, I told you the most common bacteria is the E. coli, but we have several other bacteria that might cause to urinary tract infection. So we do that. We grow these bacteria to know which specific bacteria has caused the infection, UTI, and then the kind of antibiotics that the patient will be responding to. Others, we go ahead and do whatever we call the ultrasound, because if it has ascended too, it might bring some complications. In that case, a complication like pelvic inflammatory disease. So all those can be done. We do urine microscopy. All those ones can be done. We do prevention by rehydrating. You rehydrate yourself. Drink a lot of water. It's very important. It is very healthy for you. So drink a lot of water to prevent this kind of infection. And then hygiene for down there. Make sure the hygiene is very good. Women, we need to wipe ourselves from front backwards, not from backward. Remember, I said the most common bacteria that causes UTI colonizes there in the rectum. So you can imagine if you wipe yourself from back to front. So it's like you're carrying the bacteria from the rectum to the urethra. And then we reduce the use of antibiotics. Sometimes we abuse the use of antibiotics. Tumbo inakuma kidogo, you rush to the pharmacy to buy antibiotic and to take. So we try and reduce the use of too much antibiotics. And then some of the complications that come with this, it can ascend to what we call pyelonephritis. Patient might be dehydrated, because I've said, like in children, they present with vomiting, so that can lead to dehydration, electrolyte imbalance, because maybe a child has vomited a lot. It can lead later on to whatever we call um, chronic kidney disease. It can lead to septicemia. So you present with the symptoms, fevers, headache, and then if you go to the hospitals, the only thing they see, the leukocytes are raised. Maybe they conducted what we call the full hemogram, and the leukocytes are raised. So they keep on treating septicemia, infection, general infection in the body. So we need to keep our hygiene very good, so that we prevent such kind of infections. And above all, we